Well, hello and welcome to the Scotland-Malawi Partnership SNP meeting on COVID-19. My name's Stuart, and on behalf of the SNP, we hope that you and your family are well. Everybody's equally welcome in this call, with the sharing of all perspectives on the virus and its impact encouraged. We're delighted to have such strong representation again today from all over Malawi and Scotland and beyond, and that senior figures in both nations join us today, including the co-chair of Malawi's Presidential Taskforce on COVID-19, Dr John Phuka, and the Scottish Government's Minister for Europe and International Development, Ms Jenni Gilruth, MSP, and Malawian Honorary Consul in Scotland, Dr Peter West, all protocol observed. The Minister will be with us for 25 to 30 minutes before Ms Gilruth has to go to another meeting. We appreciate that, and you're taking your time to be with us, Minister. Thank you. This is especially timely with international commitments being a part of the Scottish Government's programme for government, which you published on Monday. As ever, may we invite everyone please to remain muted with videos turned off for the stability of the line. When invited to speak, please do unmute your mic and click your video camera. Focusing on our first 30 minutes together, I'll pass to our CEO, David Hope-Jones, in a second to remind us of COVID-related support that the SNP is keen to offer members. We'll then hear from the Minister, Ms Gilruth. With time in mind, when listening, if you have a question or a comment for the Minister, please type them into chat. We'll only have time to voice one or two, if that, but by putting them into the chat, you're sharing them with everyone, the Minister and Ms Gilruth's officials included. We know that the Minister is, as we all are, especially keen to hear updates from Malawi, and we'll turn to Dr Phuka for that. Time for questions then for Dr Phuka and Professor Mapando, Principal of the Medical School in Malawi. Appreciating that I think around 1:40 UK time, 2:40 PM Malawi time, the Minister will depart for her next meeting. David, over to you.
Thank you, Stuart. I'll be perhaps atypically brief and concise. As Stuart said, timing is very short. But I do want to take a brief moment to highlight the support services that we have available for COVID. Firstly, to remind everyone, this is the 8th in our series of COVID Zoom coordination meetings. The videos and notes of the previous 7 are all available online. I've just been given fresh numbers, and I'm told over the last 7 meetings we've had 253 organisations and individuals taking part, with a total attendance of over 570, with 96% rating these meetings as very good or excellent, and 93% saying that they help strengthen their links with Malawi. Thank you for all who have taken part and given that really encouraging feedback. Please do be active and engaged through this meeting and give your feedback at the end. Also, to highlight other services and support, we have our principles of good practice for NGOs and funders responding to COVID-19 that this group agreed back in May, with extensive input from Malawi and Scotland. We will continue to promote and advocate that, and thank you for the messages of support we've had for those in the last couple of months. As of today, we're now promoting 20 fundraising appeals specifically for Malawi, and we've had thanks in the last week from Liverpool Wellcome Trust and the Gift for Givers for some major donations that have come through the SNP. A reminder that our Slack group, our COVID Slack group, is our preferred channel for direct communications between our members on COVID-related things between meetings. There are 5 channels there. Please do join. We're also very keen to continue to promote members' perspectives on how they're experiencing COVID, whether they be through videos or blogs or articles. So please continue to share that material, and we will disseminate through our online hub and through our bulletin. Also, just to mention that online hub, there's information, resources and documents that are there. Please continue to email those to us, and we'll keep those web pages live and updated. All of this fits together into our COVID-19 response strategy, and our thanks to the Scottish Government for the core funding that makes all of this possible. Information on everything I've talked about there is available on our website. If you just Google Scotland-Malawi COVID, you'll find that there. I think that was everything I wanted to cover in my 120 allotted seconds. Stuart, back to you.
Thanks, David. Ms Gilruth, may I warmly invite you to address us.
Thank you, Stuart. And good afternoon to everyone. Wule Wanje, please correct me if I've not said that correctly. I'm delighted to join you this afternoon. I met with David and Heather back in March now, which feels a lifetime ago. So it's a great opportunity for me to join you this afternoon. Unfortunately, I have a meeting related to Brexit straight after this, which is why I have to leave at 1:45. So I just want to say apologies for that. I would much rather stay in this meeting and talk to you about SNP and the fantastic work you're doing, but the other side of my role requires otherwise. So in terms of where we are, I think it's a good moment, I guess, to reflect in terms of Scottish Government's commitment to international development, but also I'm really keen to hear from you today about the challenges that have been caused by COVID-19 and how these are being approached in Malawi. I'm keen to learn a bit more about that. The pandemic has obviously impacted on all of our daily lives. We're having this meeting via Zoom today. This is the new normal, and unfortunately it's probably likely to be so for quite a long time yet to come. I know that this is the 8th of a series of COVID-19 Zoom meetings that have been hosted by the partnership, and obviously during these uncertain times we all need to look at new ways of doing things. So this will include for all of us ways of looking at technology and virtual events such as these, and I know that my officials are looking at how we can facilitate those kind of visits, virtual visits as it were, going forward. In April, the government published our COVID-19 framework for decision making, and within that framework we committed to renew the country, but also to build a fairer and a more sustainable economy and society. We're also clear that we need to look outwards, and in doing so committed ourselves to supporting our international development partner countries. COVID-19, as you know, has impacted on a number of the projects that we support in all of our partner countries, including Malawi, and we are continuing through this unprecedented time to support our partner countries in their efforts through projects funded under both the IDF fund, but also separately through the Climate Justice Fund. In March, my officials had asked projects to look at carrying out impact assessments in relation to COVID as part of their end of year reporting, and to look at whether or not their projects could assist in the COVID response. And I'm really pleased that the majority of projects in Malawi have been able to continue at this time, with some changes made where necessary. Some of these changes have required additional funding for projects for PPE, for example, where that was required for health workers to work safely. But we've also looked to support some organisations in adapting digitally to deliver their projects where possible. So a good example is the additional funding we provided to the Malawi College of Medicine for the procurement of digital devices to allow for online teaching to be delivered to key medical students. But we've also considered how we monitor the situation closely in terms of looking at our partners and others on the ground in Malawi. And over the recent months, I've hosted a number of roundtable discussions with our partners in Malawi, and I find those conversations really insightful. Obviously, that's been a great opportunity for me to be updated on the projects, but it's also really important to me as a minister to hear firsthand from our local partners how COVID has been impacting on them and their communities. But it's also given me pause for thought to think about how the Scottish Government can respond uniquely to the challenges that COVID has presented. You will probably all be aware that on Tuesday this week, the First Minister launched the Scottish Government's Programme for Government for 2020-21 in the Scottish Parliament. And the new programme focuses on how we recover from COVID-19 and also how we best position ourselves to adjust to this new normal, looking at the activities and the policies that can best deliver our national performance framework. Now, Scotland will continue to participate as a proactive international partner. We are ready to engage and to support others as we continue in this global effort against COVID. But of course, our response to COVID isn't and shouldn't just be limited to an attempt to find new ways to recreate life as it used to be. And the UN's plan to build back better in that respect calls on governments to use the current crisis as an opportunity to create a more sustainable, resilient and an inclusive society. That's absolutely the approach that Scotland is taking. In relation to international development, you will be aware that the Programme for Government set out that we've ring-fenced £2 million of the International Development Fund this year to contribute specifically to COVID-19 efforts in our partner countries. And it is my strong view that we use this funding to best protect the most vulnerable from the effects of COVID in our partner countries. We also set out my intention to renew our approach to ensuring that we are focusing our contribution on areas. Can I just check everyone can still see me? I'm just aware that my internet connection's a bit, there we go. I think we should still be online now. We also set out my intention to review our approach to international development, ensuring that we are focusing on our contribution on areas where we can make the biggest difference against the new reality of COVID. I think that COVID has given us across government a time to pause and reflect on how we deliver things. And actually, in many sectors of government, we find that, for example, in the health service, we were able to come up with some really creative solutions that, previously might not have been able to work because the system wasn't engaged in that way. And actually, for some sections of government, COVID has given us the time to look at what we do and, as the UN has advocated for, to build back better. So I think this is a real opportunity to consider how our international development programme responds to this new reality of COVID in terms of delivering on our commitment to our partner countries. But I also think that our approach to international development in Scotland is rooted in a partnership approach, and I think that's an absolute strength of the system. And I do think there's a contrast here between what we're advocating in Scotland internationally and where the UK government unfortunately seem to be headed in terms of international development with the merger of DFID and the FCO. So the COVID-19 pandemic has demonstrated the importance of international cooperation. We need countries to work together as never before to ensure we emerge through this pandemic with a green economic recovery that has inclusion and well-being at its heart. But working collaboratively has been a key feature and a strength of our ID work to date. A good example of this is our long-standing relationship with the Malawi College of Medicine. And as we look to consider and to work with partners in terms of developing Scotland's role in rebuilding a better world, I can commit to Scotland remaining an outward-looking country with a values-based approach. So I want to thank you all today, and SNP in particular, for the invitation to be with you. I look forward to hearing more about the challenges caused by COVID-19 and also how these are being approached in Malawi. And I think I will stop there, Stuart. Thank you.
Minister, thanks very much indeed. Great to hear that you're so receptive to hearing about the challenges that the community are facing through COVID-19, and naturally a standing invitation to you to participate in any future meetings. Some questions in chat. We'll make sure that these are made available to you from Professor Paul Garside at the University of Glasgow and Professor Heather Kubi, our chair, who's also at the University of Edinburgh. So with time in mind, Dr Phuka, the co-chair of the Malawian Presidential Taskforce on COVID-19, may I invite you to have the floor, please. Dr Phuka, I wonder if you're still able to hear us okay, and if you'd kindly unmute.
Thank you very much. So I have a few slides to take you through quickly, just to speak to the epidemic in the current state. I was struggling myself, so at least somebody should say hello so that I'm assured that I'm being followed.
Yes, we can hear you.
Thank you.
Yes, we can follow you.
Yeah, so I will take you where we are in the pandemic. Just under 6,000 cases, with really numbers slowing down in the past few weeks, maybe going back to about 6 or 8 weeks when it started slowing down. And largely July was our worst month, so I'll try and show that. And then we are highly limited in terms of testing. And then what sort of, why are we courageous despite that to say that we are going down is some of the answers I will try and say. Then I would also want to say, despite that we are going down, then what comes next? So emerging from the unknown to the current knowledge, and then also the future. How should we plan for such kind of unprecedented events in the context of pandemic, but we had declared ours as a disaster. And then indeed in the region also, Malawi, you may recall the issues of weather-based disasters. We had a history of Idai, Cyclone Idai, and so forth. So what do we want to be thinking for the future in terms of such? Thank you. So just under 6,000 with recoveries sort of increasing. That's 3,500. So I've taken the dashboard in our local language. I should have used the other one, but the 5,579 are the total number of cumulative cases. The 3 represents those that have just yesterday's data, and the active cases are 3,500 recoveries. The 45,000 are the tests we have been able to do when we have lost 175 Malawians to death. This is as of 31st or 1st of September, reported on 1st of September, the cumulative curve, and then the moving average, 7-day average, the orange line, which is sort of declining. And then maybe one could say that starting from mid-July, we begin to see that element of a decline, or one could say that between June 30th and 1st August, then it's sort of a flat phase. The same, but based on weekly sort of aggregates, again showing a peak by week, and then week 35, we are clearly on the decline.
Dr. Phuka, I'm sorry to interrupt and break your flow. Just to double check, we are, I think, only seeing your name at the moment. We're not seeing screen share. I wonder if you've hit the green button.
Oh, okay. Let me see if
it's just starting now. Great. And I think it said double click to share full screen, but we can see that well. Thank you.
Is that better?
That's great. Thanks. Sorry to interrupt again. Please go ahead.
Yeah, no, that's all right. Thank you very much for that interruption. So that's the curve I was talking about. The weekly data that I talked about. The number of tests and positivity that we were able to do. So we see that the positivity is relatively high, but now we seem to be going down. Per 8 tests, we seem to be seeing 1 case, but this is and the average number of tests that we're able to do on that. And then this is distribution of the cases by age. And then we see that the age range is, maybe this also is distribution based on the population distribution at present in Malawi, but relatively young age with the sort of peaking around 30, 35, those affected. This may speak to relatively also low case fatality as compared to Western countries, perhaps. Number of admissions, again, this sort of seems to be declining with a 7-day average. Number of deaths sort of following the same. I'll explain a bit more to this, better diagrams. Men are largely affected than women, both number of cases and number of those that we are losing. And when you take that statistically, I think even death is much more, even per number of cases, amongst men than women. So men are suffering both numbers, but when they're even the condition, they're also suffering more. And we seem to see a little bit of a delayed response or reporting to the healthcare amongst men. I'll just try and explain a little bit of the speed. In the early phases, we saw doubling of the cases every 2 weeks. This is another way of where we are perhaps now. You notice that we had the first 1,000 cases in 85 days. Then we really went down quickly to about 14, 10, 11, 15, and we're going back, meaning that perhaps indeed we have confidence in the slowing down. The same looked at from caseloads per month, maybe quantum that people can easily understand. April and then July is when we are hardest hit, and we expect that in September the numbers will be really down. The same with deaths. July again, corresponding to the caseloads. So again, September we expect much lower, maybe in the range of what happened in June or a bit earlier. This is where the disease is, mainly in the cities and other where there's epidemiological elements of travel and so forth. Nkatabe in the north, and Zuzu area, and Zimba South, Zomba, Mangochi are some of the hardest hit. And in the port of entry districts, Karonga and Chinji come sort of next, and Mwanza. Some of the early factors that could have influenced: we closed school early. We may have completely changed in terms of our traditions, in terms of hand washing, but as well as greetings and so forth. Imported cases were very important. We saw clusters and in propagation and to community level. Lately, the prevalence, of course, we estimate it to be around 13 to 15%. Returnees from elsewhere, we seem to see decline in the numbers, but prisons have become a recent concern. We have seen lots of use of masks, and perhaps hand washing could have also increased. We seem to see that. Those could be some of the more recent factors. We are going to be opening schools. Maybe that again becomes an important element. The trends in terms of testing, we have been challenged, so maybe people can question us. Maybe we would have seen much more numbers indeed, but from early July, we started prioritizing to manage our testing capacity. So where we are, perhaps one can question us, say, you're not doing optimal testing. And then later on, we also lost the Gene Expert platforms because of lack of reagents. But we still believe that the 6-7 weeks, maybe up to 8 trends, which is consistently on PCR, is still telling us what is happening. So we have some degree of confidence in our testing and in our statistics. Where should we focus on surveillance? Prisons, institutional workspaces, schools as we open, but schools are a little bit complex. It could be schools, but maybe the surrounding communities, because schools, parents, teachers, and the students themselves, the learners themselves. Hospitals perhaps are the most important key where we can do our surveillance that can tell us a lot. The reason for that is that typically severe cases are about less than 5%, and all those that are suffering from COVID, we seem to see all of them reporting. Therefore, we can extrapolate the 15% mild to moderate symptoms, and in the 80-85, we can extrapolate. So despite that we are not doing all the tests as we wish, we still are relying quite a lot on the severe cases where all the hospitals seem to be capturing those. And we prioritize our testing to make sure that the severe cases are always tested. Our testing capacity is low. At the start of July, we had 34,000 tests in green in the middle area there. And then we just about a week ago, we had 18,000, and we're draining those really quickly. Now, as we speak, maybe we have, we started this week with about 10,000 tests. Test positivity is a major important, the positivity rate. We seem to see that rising and then going down. And this may be the more important aspect. The reason being that because we are prioritizing the testing, those that are self-selecting could be positively biased, the ones that are coming. And then amongst that population, we keep seeing a dropping number of positives. So at some point, it was really high. and now that is getting to around 3% or less, more and more. So the positivity rate is what we are tracking as well to say what is perhaps happening out there. Some of the special sectors, healthcare workers, we have about 10% healthcare workers, and this is the distribution. Again, it follows into the same districts where there's high burden, and maybe this is how we're seeing those. So although we're talking over all healthcare workers, the others are non-professional, a little bit of those, but nurses are affected more than clinicians, lab staff. So this is an important sector, more especially also in the context of our own college. We want to learn from this to say, what do we expect? How would we handle our students and so forth? Because we're now going into opening of schools. Then moving from coming from a non, then the future plans. One more important element is that we declared our pandemic as a disaster, but that declaration lasts for 3 months. And then I think the theory really comes from that you can have one impact and then the rest is recovery, and then there's reducing cumulative effect all the time. But COVID is reasonably different. So we have had in the past, of course, continued increase in dosing, as well as increased dosing. Therefore, whatever we're trying to gain is really a challenge. So maybe at this point, we're coming to a point where the red line on the right is perhaps being captured. So maybe it's slowing down, and then maybe the green will continue. Then at that point, that's when things, so we're trying to predict when that happens. But clearly, this brings a new question. How do we coordinate COVID response? Because the disaster approach may not work. And then in terms of resilience and other things, maybe we need to think very, very differently from how we declared this as a disaster, from which the Constitution says, if you declare, then that state is only for 3 months. So way forward, taking all this together, we still need to continue risk communication so that we can continue the containment, advocacy for and community mobilization, infection prevention, testing, care and treatment centers, case management. This, we have seen an increase or improvement in case management, because initially we had small treatment centers, but COVID demanded by itself to go to the central hospitals where it was largely managed. And I think it has been a privilege because we have had oxygen plants, at least at Queens in the south. There's a plant coming for Central Hospital in the Longway. And then we hope that we'll be able to get, or we need to get a plant, at least in Zuzu. And maybe some of those are moving forward for resilience in future of similar, we can see the pattern of such. And if we had a rebound or recurrence of upsurge, then the other districts like Mangochi, Katabe, and Zimba South, Zomba, we need to upstage the treatment. But there's been some kind of upgrade in that. Coordination is clearly, we were doing, once we do that, it means that the Department of Disaster becomes responsible, but that department is meant for natural disaster response. So we want to sort of alleviate it from that responsibility and create a COVID response system. Decentralization is one major thing that we are doing. So shifting from the central level, taking this to the response to the different districts, and then all the way to the chieftaincies and villages and so forth. In the past week, the Presidential Taskforce has been meeting chiefs and religious leaders to support and DCs, district commissioners from different districts, to make sure that there's a strong community approach. So decentralizing the response is one of those elements. We clearly need to institutionalize the response, both at national level. We have FIM, but we clearly think that the combination of disaster needs to have an institutionalized approach. So the Emergency Operations Center is in the vision, which is a center that will be 24 hours looking at this, and perhaps Similar centers need to be in institutions like the colleges so that people are trained, but also they can easily move in to support the response. And it is in this spirit that myself from the College of Medicine, I am supporting, but we don't have a structured mechanism for that kind of response in a way. So within the college, we are thinking of that. Training needs to be there, institutionalized as well as emergency response, because we've seen that it's not just about those that are in the medical field that are responding to this, but everybody, social sciences and so forth. So we need to sort of bring this at education institutional pre-service level to include training of this nature. Coexistence with COVID is now moving forward. That is very important, opening up of economic activities. And then again, development of a resilience plan, recovery plan, and responsiveness. We have struggled quite significantly on the legal setup because there's incongruences between the Constitution, Acts of Parliament, and some of the policies and so forth. So we really need that to be reframed. Then we need some very clear restrictions and easing indicators, because maybe we jumped into closing schools without very clear ways of how to reopen and so forth. So those indicators need to be very clear. And then what could be the preceding time so that we can have significant early warning systems that are in place. We clearly need continuity of social and developmental services. We're hearing stories of girls struggling quite a lot, lots of unwanted pregnancies, lots of myths going around. So communication is important. And then education, health, gender issues need to come into place. Population issues, the youth, girls, maternal and child health, of course, geriatrics become an important issue here. We clearly want to open the economy because we're struggling, there's no revenue. So trade, the airspace is being opened, borders will be opened with that courage, although we're not doing optimal testing, but we believe that we need to be courageous enough and do that. This is again taking into context whatever is happening in the region, where we see even in South Africa, where the hardest hit, the pandemic is on the decline. So key issues, just to sort of summarize, I mean, after talking quite a lot, one would say, what are the major issues you want to do in the immediate? So opening of economic activities, reopening of schools so that we can continue to have a child development, airspace for transport. This is happening maybe now, or I mean, from this week to next week. The national coordination, we want to start to set up a coordination COVID response office. We want to develop a national strategy, center of excellence for emergency response within the academic environment. This really to look at this, but also COVID response, but beyond that to integrate with occurrences and precedented occurrences like disasters, maybe from earthquakes, which are also on the rise in terms of frequency and intensity. And God knows if we had all these happening at the same time, we are Ebola prone and all these. So what happens if we had a COVID like two of those at the same time, plus a disaster? We need to have some kind of research-based, evidence-based, and also just to archive what has happened. Because a lot of what we have struggled to respond is we don't seem to have a known, we're coming from the unknown. And then we want to make sure that should this happen again, there has to be archives that we can draw our lessons from. So, and then the revised response plan, institutionalization, and then the legal aspect, we need to sort out our legal issues. What does the Constitution say, the different acts, and then the different aspects that enable the enacting of the laws that we have. Thank you very much. I will stop there.
Dr. Phuka, thanks very much indeed. You've covered a huge amount of ground there and stimulating many questions and comments on the chat. Just to mention to everybody that the presentations we'll make available online on our website. There'll also be a summary put up, which David writes and gives very masterfully at the end of each of the sessions. A recording is put on YouTube of the entire session, but my colleague Craig also puts up timestamps of what of when different sections appear, so that people can find them easily. Now, as I say, there's many questions for Dr. Phuka. We have a brief window, however, to be joined by Dr. Antonia Ho, who is clinical senior lecturer and consultant in infectious diseases at the MRC University of Glasgow Centre for Virus Research. Tony, I think you're going to share with us findings of a recent COVID-19 healthcare worker study in Blantyre before understandably moving on to your pressing clinical duties. Over to you.
Yeah, thank you very much, Stuart. As Stuart says, I'm based at Glasgow University, and I just want to very briefly share some results of a small study that I have collaborated with the University of College of Medicine. Let me see if I can share my slide. Can you see my slide?
Yeah, it says it started.
All right.
Yeah, that's just it coming up now. Great.
Great. Okay. So we got some Scottish Funding Council GCRF funding to do some rapid COVID-19 research. So in collaboration with the College of Medicine, Professor Mopatsa, who I think is on the call, as well as Tony Narenda, who's the local PI, and Chris Moxon, who's also on the call, we recruited a small cohort of healthcare workers and general public, because of course there's huge concerns from other studies that came out of China, the UK, also the US, showing that healthcare workers are at greater risk. And perhaps healthcare workers in Malawi are particularly vulnerable given possibly the lack of access to PPE as well as infection control procedures. So this small cohort recruited people from three health centres, Queen Elizabeth Central Hospital, as well as a Blantyre District Health Office, which who were responsible for doing contact tracing of confirmed cases. Between the kind of middle of June to early July, we recruited 300 participants. Half of them were healthcare workers and the other half were community members. And at 3 time points, which we've just completed, so at enrollment at 4 weeks and 8 weeks, we did nasal and oral pharyngeal swabs and took venous blood. So we at the moment have results for the PCR data. So we provided some of the first data on, people without epidemiological risk and identified a very high prevalence of asymptomatic infection. So at time point 0, so between middle of June and early July, we find that 11% of healthcare workers and 13% of community members were SARS-CoV PCR positive. Very few of them reported any symptoms. And reassuringly, it looks like healthcare workers were not at increased risk compared to non-healthcare workers, although there may be confounding factors. We're just looking at all the other baseline data now, and it looks like the community members have much higher rates of HIV infection, 24% compared to 4% in the healthcare workers. On the table down here kind of shows you the breakdown in terms of the majority of people we had recruited were nursing staff. So we submitted this data quite early on, as soon as we had it, to the kind of national COVID Taskforce, as well as the surveillance group, to advise them that this was our findings. And at our 4-week time point, we actually found an increase in prevalent PCR positivity of 17% in healthcare workers and 25% in non-healthcare workers. I'm sorry I missed most of Dr. Phuka's presentation, but we have literally just got the 8-week data, and the prevalence has come down to about 5%, which I think is reflective of what has been found in terms of decline in case numbers. What will be interesting now is to look at the accompanying ELISA data. We've had some issues trying to get reagents into the country because of the kind of lack of commercial flights, but the cold reagents have just arrived this week into Malawi. So hopefully at the next meeting, maybe we can share some of these ELISA data with you to look at how whether people who are mildly symptomatic or asymptomatic develop antibody response, and how what that antibody response looks like over, certainly at 4 weeks and 8 weeks, given that we have such high rates of infection. We've submitted another grant application to look to see if we can extend this cohort, given that, you know, we've recruited this cohort already, and would be interesting to follow up to look at kind of durability of antibody response and whether they're prone to reinfection, because that's again very topical, and this hasn't been looked at in much detail in settings like Malawi. Of course, there are now kind of antibody studies that have been published from Kenya and Mozambique as well, but it'll be interesting definitely to look at this. It'll be very important in terms of informing possible kind of responses to vaccine in due course. So thank you very much for allowing me to speak, and I'll hand it back to you, Stuart.
Thank you very much, Dr. Antonia Ho. And does anybody have any questions for Dr. Ho before Tony shoots off to the next meeting? Well, we can follow up anyway. Dr. Ho, thanks very much indeed for joining us again.
No problem. Thanks for having me.
Thank you. Dr. Phuka, if we might return to questions for you. There are at least 3 that I've seen so far on the topic of schools and colleges. Will the reopening of schools lead to an increase in COVID cases? Claudia Loza, would you tell us about the latest plans for reopening schools and colleges from Nick James? Andrew Mutewa, around the risks of masks, dirty masks, and he says carbon dioxide toxication and non-compliance. I wonder if you'd care to tackle schools to start with, please.
Yeah, so in general, the process towards reopening of schools, we had a subcommittee that looked at that and came up with stringent, reasonably very good, to be honest, measures. I'll talk about 3 elements around those. Community involvement. In the community involvement, whereby kids should be oriented even to hand washing, what to expect before they go to school. Then the school environment. To make sure, also of course in the transition period as they drive from home to or walk from home, to ensure that they are oriented to practical elements of social distancing, not to play too much and so forth. But the principles is largely, before they go into class, their hands are clean. Yes, use of mask, and there's a age limit for use of mask. Below 5, no. In the preschool, our school starts at 7 years in primary school. So preschool, we want to start with when we start 5 and 6, because 6 to 11 can use mask under supervision, but 11 onwards would be able, it's guided that they can use a mask. So either preschool, primary, will, based on this stringent use of mask, either under observation or not. Hand washing within classes or sanitation within classes, and then again reduced play and so forth. And then the third is the other populations around, what is happening in the community as either the open and go schools. What is the purpose? Is it protecting students or spread from students? All these have been taken into account. And then yes, as I've said, for the young ones, in terms of the hygiene, they can only use under observation. So maybe that covers the issue of how to use the risk of dirty masks and so forth. There have been some funding through UNICEF to support more especially primary and secondary schools. So that's where the support partly is coming from. All schools have received buckets. Clearly we have wash issues. These are being taken care of with partly community engagement to support where water is not available. But again, we'll have a sort of upgrading of water systems, including bringing of boreholes and so forth. Maybe that sort of answers the school reopening issues. Thank you.
Thank you, and lots of thanks and praise on the chat function for your wide-ranging and comprehensive presentation. Would anybody else like to come in with a question for Dr. Phuka? Please just say your name and your organisation. Well,
Stuart, can I come in?
Please, go ahead.
Thank you so much. Thank you, Stuart, for the opportunity, and thank you, Dr. Phuka, for your able presentation. My question is with regard to the prisons. I am Alexius Kamangira. I work for Reprieve, and I wanted to ask, in relation to your presentation, you mentioned prisons as places of concern. And indeed, in Malawi, I've witnessed problems in prisons. We understand that the effort to decongest prisons, which are about 260% overpopulated, has focused on the people that are less than 6 months on their sentence, and through the presidential pardons, leaving behind the sick and the elderly, who ironically are the highest threat with regard to COVID-19. I wanted to find out if the presidential task force is taking any effort to ensure that these people are considered, despite their sentences, in the next presidential pardons, as well as any other effort that are being taken on decongestion in Malawi. Thank you so much again, once again, Dr. Phuka.
Yeah, so the prisons is highly complex environment. We really thought that we would quickly get maybe half of those out. We had 14,000 when we started, over 4,000 or 5,000 capacity, and then clearly that means, as you put it, over congested in the range of 200 plus percent high, and we only got about 500 pardoned. Maybe the next day the pardon happened, we already also got a few more going back because criminality is there, and then I think there's also issues around remand and whatever that is, technical issues in there. But just to speak a little bit to the prisons, the statistics range from the highest is about 60%, but in a small prison. But the factors that again, they are over congested. So yes, we have been thinking in terms of those lines, and there's where there are few, we're transferring others into, for example, Cholo prison, taking some from Chichiri prison and so forth. The case fatality rate is very low, despite the, and we think that this could be because large population is the youth in the prisons. So of over 200 cases, only 2 as of last week had died, which is really like 1%. So that came with sort of reassurance. Those that have not been pardoned, largely again, it's the type of cases that they have. So the pardoning has a complex mechanism that they take. So to us, what we're saying is whatever is happening in Malawi to COVID should also be an opportunity. In the short term, yes, decongest, but I think it's a big question about the resilience, responsiveness, legal applications and whatever, so that moving forward, really, we should be looking at long-term restructuring of everything. So even the prisons, the remand, which is somewhere between when you're convicted and your case, how should the judiciary work? So we've pushed the judiciary to do mobile courts, and then and also the judiciary to actually visit so that they can appreciate. So all these in that complexity are happening, but pardoning alone doesn't seem to be practical because of the legal issues around those. But also the judgments from now on, or despite lack of accountability, we would want non-custodial sentences.
Alexius, thank you for your question. Claudia at SCIAF. Claudia, would you like to come in with your question you've put in chat?
Yes, sure. I would like to ask to Dr. Phuka if there is a plan to overcome this issue presented by our partners related to the education, because they are afraid that some schools and institutions do not have enough washing facilities for the students. So they are afraid that the student might come back to the schools, but they won't be able to do the hand washing procedures. And then they are also afraid that vulnerable families will not be able to afford the price of masks. So my question is in relation to this, and how, if there is any plan from the government to address these issues, as they are very important. Thank you.
Yes, so the opening of schools is in stages, in the sense that we start with mostly classes that were meant to sit for exams. And then for about 3 weeks that goes on so that we can learn, and that allows physical distancing. It allows that for us to experiment on all these other measures, hand washing, and to observe, can we really implement it? So there's a cautious approach. In terms of, so that sort of helps on the washing facilities and so forth. But as I've said, there's funding that is there, that is bringing hand washing resources, buckets, soaps, that are being distributed to all districts, even beyond the district, directly to the zones, to implementing primary school, for example, implementing areas. So there is funding to support those. And this came after some survey that looked at what are the needs. We clearly have a gap, but it's moving forward. So as we increase the number of presence, or number of that come to school, then we're also hoping that more and more partners will come and support us, and then maybe the government will bring in more and more support to that. In terms of masks, yes, masks are a challenge, but the government has partners, including UNICEF, CDC, and then there's also local NGOs like Mask for All that are gonna come in and support provision of masks to those that can't afford. But there's also decentralization of production of masks so that people can learn what are the specifications, the 3-layer community masks with all the parameters of quality for those are being taught not only to communities but also through school teachers and so forth, so that these can be taken up locally, and then perhaps we can solve the issue of masks. But clearly we believe that masks are very, very important.
Thank you. Staying on schools and with a particular interest in rural areas, which is something that very many participants registering to take part in this call emphasised as an area of interest and concern, Dr Phuka, rural areas and provision there. Jonathan Groves.
Hello, yes, thank you. We were just wondering whether this means that the UK partners should not concentrate their fundraising efforts towards getting buckets, hand washing facilities out into all the schools, particularly in the rural areas. If this is going to be something that is coming from central, we're always concerned to be filling the gaps between the things that come from central government to help the rural communities, and so we don't have duplication of effort here.
Yeah, the question, to answer your question, maybe at this point I don't have the realistic data, to be honest, because there is effort towards that, but one may not say the question of adequacy is what I may not be able to, because the real situation will learn once we start using. I would not be too satisfied with whatever has been provided. What has been provided most likely answers the question of how can we start, but moving forward to maximize the use of schooling space versus the supply is likely going to suffer in one way or the other. And much as we can want to protect, there will be likely issues like damage, a few maybe losses. So one would still want to have a backup mechanism. So I would not stop doing that. In the holistic sense, it's a $5 billion, or if not $5 million US, or I've forgotten the number. It starts with 5, but it's a huge number of or a huge figure in terms of resources that's required. I doubt whether we have all that money. In a nutshell, we had less than 50% of the resources required to have a full operation. So I would not stop. I would choose to complement to say which district you want to operate in, and then maybe support that. But clearly, I would say there isn't enough. Clearly, there isn't.
Mary Popple.
Hi there. I'm just following up also on Jonathan's question. We have been asked by our partner CASFA, which is our smallholder farmer, rice farmers in the Karonga area, to help them provide masks for the whole family rather than just the school children. And also they have a concern that people still don't understand what COVID really is. And they are very concerned that communication should continue. So we are putting together a fundraising campaign to help with that. Is that communication still going on via yourselves as well? And thank you for a wonderful presentation, by the way. Thank you.
Yeah, so in terms of risk communication and community engagement, this is an area where we clearly have a gap. And the gap is even in the organization of the communication process. So we have been thinking of having a communication strategy, and this we don't have. We've sort of been doing firefighting. I know we have sort of upstaged in terms of frequency, radio frequencies. So for example, what we are doing now is we have a TV press briefing. It goes to all the TVs, but it also goes beyond one radio station to all the community, as much community radios as possible, and then so forth. But no matter how you do that, you soon realize that even with radio and TV, you come to a standstill. You have limitations. So we also want to go with broad sort of vehicle-based broadcasting in the different communities. But yes, in short, communication, risk communication is a gap. We've tried to give them a bit of funding, so there's a little bit of activity now there, but we need to sustain it for a while so that we can even hold down the prevalence or the occurrence of the disease where it is, fearing that there can be a rebound element. And yes, even the school response is starting from the community. So I wish I had brought some pictures that were presented yesterday from the Ministry of Education, how they have engaged, and we are already seeing the community as training young kids in hand washing and so forth in preparation for the coming to the school. So it has to be a comprehensive approach in schools, amongst teachers, and the community itself.
Olivia Giles.
Sorry, I missed the comment.
Olivia, are you there to ask your question? So it was...
no, can you hear me, Stuart?
Yes, thank you. I'm sorry.
Okay.
I've guessed your surname wrongly, which was very foolish of me. Sorry, go ahead.
No problem, no problem. Yeah, I'd like to start by congratulating Dr. Phuka for a very detailed and insightful presentation. My question is to do with rural areas once more. In Malawi, one of the greatest and hardest challenges is water in the communities. And in addition to actually the availability of water, due to poverty, households do not have enough containers to have the type of water that would assist us in being clean and frequent washing of hands to combat COVID-19. And yet Malawi as a government, and this is where I think partnership with Scotland would come in terms of advocacy. Malawi as a government has not prioritized or purposefully given water prominence by actually giving it its own ministry, because the type of interventions we need in education that we need to have these water drilling and programs all over Malawi, and yet it's not prioritized as a ministry to focus on water and sanitation to assist the ministry. So I just wanted to find out from Dr. Phuka whether this has a reason in terms of an intervention strategy for COVID-19. Thank you.
Hello, yeah, so the way I've supported the government is oftentimes to what I call staying in the lane. So when questions are political, often I have deferred them to the politicians, and I wish I was here with my co-chair, who is the Minister of Health and a politician, and may answer. But my understanding is, because this question is coming from different aspects. For example, there's a similar question that came on people living with disabilities. Why don't you give them a specific ministry? And on the other hand, I think with austerity measures, the new government, because I've worked with two different governments, the new government reduced the number of ministries in the interest of austerity measures to reduce spending. And my understanding is that the answer that has come, for example, from the other question that already came elsewhere, was that activities should not necessarily be submerged because they're aggregated with some other ministry. It is the clear strategies planning that should work. And if there's a responsible officer, he should, for as long as it's within what one as a minister can deliver, then that's okay. For example, even our own presidential task force was trimmed from a number of 21 to 12, again to reduce expenditure. So I think they are also looking at that, and being in the COVID environment, I'm told the revenue collection is really down. So the point is that how is the WASH itself being considered? To me, at least from the education point of view, it is very clear that they have looked at WASH issues very strongly. And then there's community engagement. Yesterday, I was meeting chiefs. For example, in Chikwawa, the paramount chief from Chikwawa complained about water. And then that community engagement, that sort of bilateral engagement will, at least in the first place, give us a real situation where the challenge is. And then clearly, I take personally COVID as a stimulating component of bringing things a little bit closer to optimal standards. So opening of schools is a challenge, but clearly I'm sure I would have wished personally I went to school in the coming weeks in primary school, taking my primary school times back, because there's clear efforts towards making sure that there should be water to prevent this disease. And maybe what we'll see is a prevention of other respiratory infections, including diarrhea. Yeah.
Thank you.
Thank you. Madeleine Osborne. Madeleine, I don't know if you're still with us. You've patiently waited as I've taken other thematic questions. Go ahead, please.
Thank you, Dr. Phuka, for a very interesting talk. I was wondering about whether your task force had done any work on what criteria the government would use to lift the quarantine requirements. In common with a lot of other organisations, we send volunteers, in our case specialist doctors, to teach medical students to Malawi, and obviously the quarantine requirements are quite an issue for us.
Thank you. So Malawi has, since the start of the pandemic, has never implemented institutional quarantine, but we have advocated also based on faith and trust that when you talk to people, they will understand home-based quarantine. So, but in terms of international travel, we are expecting that those that come in will come with a test result. If they don't come with a test result for some reason, then they will have to make sure that they get a test done, and then they proceed wherever the destination is with data of where they will be. And should they develop symptoms, they can always call us for a test or for care and so forth. So the quarantine that we have largely, more especially those coming through the airspace, is that the collection of samples if they didn't bring the test. Otherwise, they go straight to wherever they will have to observe a 10-day quarantine in self-quarantine. That's what we are proposing. This has brought us a big question, because at the same time we're trying to observe opening of the economy. So what if somebody is coming for a conference for economic activity? If they come with a test that is within 10 days, we have two figures there. We have 10 and 14, because the Act, the gazetted rules talk of 14, but we are talking of 10 from the implementing levels, is that they can do the activities, considering again that we have community transmission. So we're trying to balance this, quite delicate, but we want to open up the economy at the same time. So I think you would be covered.
Thank you.
Thank you. Professor Heather Kubi. Heather, you had a question about testing. I'm not sure if you can still hear us okay.
Sorry, I thought I was unmuted.
Professor, should unmute.
I am unmuted. Yes?
Go ahead.
Yes, I can hear you.
Can you hear me now?
Yes.
Thank you very much for an excellent presentation, Dr. Phuka. I'd like to go back to the testing for COVID. So your statistics are wonderful, but because of the access to only a limited number of tests, do you think that that has produced any bias in the geographical understanding of distribution, or in the excess deaths that there might be, which would not then have a COVID designation beside them? That's one part, but the second part is I'm so impressed that you have carried out only 8 tests for every positive case, compared with the hundreds, even thousands that we are doing. Perhaps we haven't got the messages right about who should be having tests, and therefore, what is your feeling about the balance in effective use of the COVID tests? Thank you.
Yeah, quite scientific and intriguing kind of question. I think that if I had to choose an arbitrary number of a number of tests per positive that you'd be happy with, maybe it's 1 in 35 to 50, somewhere there about. Partly, I think beyond what we are seeing, then clearly it means you would have also opened up to contact tracing, because our testing largely is amongst those that have symptoms. So maybe that's why we catch more. But you need to have a no regret component in these tests, whereby you are doing a bit wider. Unfortunately, we don't have the privilege. I wish we at least were testing the primary contacts, and I think if we did the primary contacts, we may be able to get to that number, maybe somewhere between 30 tests per 1 positive to 50. I think that should be reasonably, in my view, where you would get to. Beyond that, perhaps there's also too much wastage. I would move from PCR from there to antibody antigen tests, but those that we have seen in Malawi, unfortunately, the sensitivity is quite low. Sometimes specifically better, but still not optimal enough. So maybe the antigen tests, if we get those in good precision, might be a way to go if you want to do wide. But if you're going to use the PCR, which is quite expensive, or a gene expert, which is slow, but also targeted for TB, I would be very cautious on how to do that. Because otherwise, what will happen is, if we overemphasize on COVID, then we may be paralyzing the other services. So the balance should also guide us. So I wouldn't go too much higher up, maybe 50 at maximum. The other question, the first question on is there a bias in our reporting because of the numbers? Clearly, I would say a bias, misclassification is more dangerous if it's not systematic. So we clearly have misclassifications in our context because we are not optimally testing, so we're not catching all those. So the graph, I showed the graph somewhere where there's one line, the optimal probable line, that we should have gone, and we stopped that in our case from early July because we stopped the contact tracing. We did contact tracing, but we didn't test. Then we suffered from the drought of reagents for GeneXpert around towards the end of July. So you see that our curve could have dropped maybe much faster, twice within July. But what I've been looking at, I've had to advise government to take much more serious decisions, even much earlier than now. But what I was relying upon was consistency. So I chose a few labs. So I created somehow a retrospective sentinel events or sites in one way or the other, not events, sorry, but sites, and looked at what was happening in the PCR, which has been stable throughout. And then I already saw decline in the PCR only from mid-July. So it was that graph that I wouldn't publicize at that point, but it's what I used to advise government. That's why they announced opening of schools by September, because I had seen that for at least 3 weeks. And then when the president announced, I was so sure that what I was beginning to see was it was likely going to continue. And indeed, to my chance, at that point I took a chance, it would have been right or wrong. It has favored that it was right, as we seem to be going down consistently. Thank you.
Tariq Mir.
Thank you very much. I think you've made very wise use of limited resource.
Hello there, can you hear me?
Yes, we can. Please go ahead.
Oh, okay. So, Dr. Phuka, just two kind of general questions, just so that I've got a standard to kind of base your data against, in two parts. One of them is, what's the normal incidence of flu or the common cold? And the second question is, how many of all the people who have succumbed to COVID-19, how many of them have had any underlying medical conditions, or has that data not been collected? Thank you.
Thank you. Just because of the quality of the telephone line, I'll repeat that, Dr. Phuka. So the first part of the question was, what is the normal instance of flu or the common cold in Malawi at this time of year? And the second part was of all of those who have succumbed to COVID-19, how many have had underlying conditions, or has that data not been collected?
We have the data on the comorbidities, and we have tried to do a death audit to look at what might have caused death. So amongst more especially those that we have lost and the admissions, we have data what is the underlying causes. For us, clearly important is diabetes, hypertension, and HIV and history of TB. These seem to be very, very important underlying comorbidities, as well as, of course, age, although the age is affected by the distribution that we have overall, so that becomes where we are. Our colleagues in the neighboring country, they aggregate data as COVID death or COVID associated. We haven't done that specifically ourselves, but yes, we do see comorbidities, and those some of those that we have actually seen to be important. In terms of the incidence, or at this time of the year, I don't have the actual figures, But the perception we have in terms of qualitative data we are receiving is that this year we have had less incidents of in the winter season of flu-like symptoms. However, we are tracking the because our testing is based on symptomatics. Some of those that have cough-like, influenza-like symptoms are the ones that we are testing, and we keep seeing less and less number of positivity, suggesting that we still have those, but the COVID status amongst the symptoms is actually getting less. Again, that's what's satisfying us, that those that we should have expected much more of COVID in there is going down. In a nutshell, I don't have a figure, but we have we're trying to see what could have happened to diarrhea, what could have happened to acute respiratory tract infections, sort of before and after studies to come up with exactly what has happened. That's, I think, the answers to the two questions. And again, why the symptoms are helping us monitor exactly what's happening because of the positivity rate amongst those that have similar symptoms. Thank you.
Thanks very much for that. And just to flag up, Dr. Tracy Morris has put in the chat function some resources, a link to some resources that Tracy, thanks very much, you've also put in the Slack group you mentioned. Susan Flynn.
Hello, sorry, it took me a minute. Shifundo UK and Chinaza Malawi do work in state schools, particularly focusing on the menstrual health needs of girls. And so I wanted to ask the question, does the government have any ideas of what they would like to do to help and encourage girls who've become pregnant, those underage girls who've got married during the closure of the schools, and those girls who've suffered violence to come back to school? Only the answers would be really helpful to know to know what kind of ideas are around, so that it would help with funding applications. Thank you.
The issues around girls, the past 2 days, the other day I was in the Central Region meeting chiefs, district commissioners, and religious leaders. The myths going out there, COVID was reported in some cases a communication issue as end of death. So some of the girls were clearly saying that I don't want to die before I have a baby, or things like those. So we had very sad moments indeed. And clearly for us now, we have involved the chiefs and others. Well, this is one way that unwanted pregnancies and early marriages have marriages have sort of been fought. And immediately, for example, for one district, there's immediately after the meeting with the chiefs, they have announced in the district that they're taking to court all adults that have impregnated any girl below the age of 18, so they will have criminal charges. So the interaction itself is allowing us to, again, go into bylaws that may be much more important than the centralized laws, but also to allow that the tracking, once we have taken this to the community level, to the local leaders, traditional leaders, then they can easily pick who is actually misbehaving. And then, yes, Malawi allows that girls can go back to school when they fall pregnant. Afterwards, they can come back to school.
Thank you. Mick James.
Thank you very much, Stuart. I just wanted to ask a question about school exams. As I've seen lots of different kind of things leading me to believe that school exams may well go ahead towards the end of October. And I just wanted to understand what, if anything, is being done to prepare students who will obviously have missed kind of 6 to 8 months worth of schooling to get them ready for these exams?
Yeah, rather very complex question as well. And members of the community in the community, we had chiefs and so forth. Others actually asked the exact question: why don't you delay exams? With that kind of suggestion. But I think the Minister of Education looks at exams as a question of achievement tests. So where it's partly formative in nature. So they have not necessarily remedial, but sort of the Minister of Education has planned to have recovery teaching or some kind of remedial teaching, so that the students, those that are in classes, are the ones first to go to prepare for the exams. But we don't expect that the time is enough. There are two things to balance. Write the exams quickly so that we can still save the time. The schedule we have is to save out of the 195 days, it will be 185 academic year next year. But that is again done with the compressing everything. The other question that arose were, are you gonna reduce the pass mark or things like those? The answer was the achievement test may not be compensated, but it is, once we learn from there, education is progressive. What remedial mechanisms can you do in the next subsequent classes? I think that is the approach the ministry is trying to save time, but also not to overcompromise. Because of one, I think that's the one answer that came out is that the exams are also meant to be of international standards. Therefore, we don't want to say, okay, Malawians are less well developed, and God knows, maybe the remedial mechanism they will do will be able to say get the student to speed.
Thank you. That's really helpful.
Thank you very much. And I see Dr. Phuka, the chair of the Malawi-Scotland Partnership, responding also to a previous question, saying that Malawi has a policy of encouraging teenage or adolescent mothers to return to school. A potential project should therefore focus on advocacy for parents to support their girls to return to school. Dr. Phuka, thank you very much indeed for such a wide-ranging and comprehensive response to all of these questions. We've covered, I think, a great deal of ground. You mentioned the Minister for Health, and we're delighted that we've had an intimation from the Secretary of Health that the Minister would like to join us. Your co-chair would like to join us for a future COVID-19 Zoom call, which is super. Thank you very much indeed for all your time. Very welcome, of course, to stay with us, but recognise also that you have pressing clinical and management duties as well. Turning now to David to tell us what's coming up. David.
Hi, Stuart. Can I check you can hear me okay?
Yes, thank you.
Fantastic. Yeah, just to flag up some dates upcoming. Firstly, the Chichewa language classes that we have starting next week. We've got a few final places left in that. We've got the Wednesday, 23rd of September cross-party group on Malawi, which will include a focus on COVID. Saturday, the 3rd of October, our AGM. That will actually include, that's the afternoon of the 3rd of October, that will include the next in this series of COVID meetings. So please do keep that date free, the afternoon of Saturday, the 3rd of October. We'll have an education forum in October. We're just firming up the date for that. The Education Minister has accepted our invitation to take part in that. And that will likely be a Wednesday morning in October, either the 7th, 14th or 21st. And then likely our 10th COVID Zoom meeting will be happening later in October, towards the end of the month, as Stuart said, hopefully with the Minister of Health. But keen to add my thanks as well to Professor Phuka. Stuart, back to you.
Super, David, thanks very much. So we'd like to turn now to a presentation by Natasha Mwenda, Natasha of WaterAid based in Malawi. Natasha, you've been involved in a number of these calls with us on COVID-19, but you also presented in the Scottish Parliament as part of the Malawi cross-party group last November. So great to have you with us and to hear how WaterAid's responding, adapting and sharing lessons with us in this era of COVID-19. Over to you, Natasha.
Thank you so much. Thank you so much, Stuart, and thank you so much, everyone. I'll try to share my screen.
It's just, that's it, just opened up. If you're able to maximize it, Natasha, that would be great.
Okay, let me see.
My technical support normally involves hit the green button, but you've already done that. So I think there's a double click, but if anybody else has suggestions, please shout.
Yeah, it seems I'm failing to.
We can see. We can see your slides, so I propose that you continue if that's okay.
Okay, you can see the slides?
We can see the slide you have up, thanks.
Okay, thank you. All right, so I just want to present what WaterAid has been doing during this COVID. Just to start with, that as WaterAid, our strategy and the change that we want to see in by 2021 is an accelerated progress towards inclusive, equitable, and sustainable access to WASH for all. So this will be achieved by having an empowered citizen that take an active role in realizing their rights to WASH, and also a strong WASH sector that is responsive and proactive, and it prioritizes the sanitation and hygiene. So as WaterAid, our work is around four main objectives. That's empowered citizens, prioritization of sanitation and hygiene, and the sustainable service delivery at scale, as well as strengthening the sector. So whatever we do, whether we are providing WASH supplies or water systems, what we are doing is modeling and ensuring that others can also adopt that and scale up. And with our funding from the Scottish Government and the other donors, we are implementing what we call the Deliver Life to Mothers, Girls and Children in the southern region of Malawi. This project is mainly integrating water or WASH and health, as well as WASH and nutrition. So we are targeting healthcare facilities, as well as early childhood development centers and the communities. So we are working also in collaboration with other partners. We are working with government at national and the district level. We also work with National Initiative for Civic Education for our citizen empowerment pieces of work. We are also working with the Army of Health Africa for our interventions that are targeting the healthcare facilities and the healthcare workers. And then we are also working with the Mary's Meals, because we are implementing this project in an integrated manner. We are demonstrating how integration of WASH and nutrition looks like. So we are implementing together with Mary's Meals by co-targeting early childhood development centers, same early childhood development centers. And we are implementing in Zomba and the Machinga districts. Just to also give a brief background on our COVID response. So we understand that WASH is the first line of defense in fighting the pandemic. And we have already seen a lot of talk on how good hygiene translates to health, the community and nation. So all the encouragements of hand washing with soap at critical times, keeping social distancing, wearing face masks, all that are to do with also hygiene. And we know that hand washing or any kind of hygiene is not possible without having access to clean water and the sanitation services. Unfortunately, we have noted that even during this pandemic, there has been little or low prioritization of investment towards WASH. So whilst there are so many calls on the need to have safe water or adequate supplies of water, but then we have seen very few donors or even other WASH players in the private sector coming in now to invest in WASH infrastructure. So that's the gap that we have identified during this pandemic. And then we have also noted that as it is with any other emergency, the possibility of abuse of vulnerable groups is high during emergencies. And we have seen some of these things happening, especially in the healthcare facilities, where maybe healthcare workers are on strike, and this affects the clients or patients due to unavailability of proper infrastructure or adequate PPE or even capacity to manage infection prevention and control for COVID. So for us as WaterAid, we took some action to help and address some of the challenges that are there. So to begin with, we provided some supplies and PPEs to over 90 health centers in 7 districts. So these are districts that WaterAid is working in beyond the project that is funded by Scottish Government. And we also supported the infection prevention and control trainings for healthcare workers, especially in Mashinga district. This is where we are implementing the Scottish Government project. And in Mashinga district, we also have one of the isolation centers for people that are being repatriated from South Africa. So we thought it is necessary for us to have this training, especially targeting these healthcare workers, because there was also some capacity gap. And then we have been also supporting provision of some supplies in these isolation centers, not only in Mashinga, but also the one in Lilongwe. The other action that we have taken is on education and increasing knowledge on COVID-19. I think there has been an outcry on how rural communities do not have adequate information on COVID. So through our partners, we have supported some hygiene promotion activities. So what we have done is that because we already do hygiene promotion and we have some packages that we use, we have integrated COVID messaging in that so that we can have some sustained change. The change should not only be during this COVID, but it should be a new lifestyle. And then we are also using the health surveillance assistance from the health centers, as well as community volunteers who are hygiene promoters. So they go in communities, they are using approaches such as loud hearing or door-to-door, because currently it is not possible to bring people in big gatherings. So we have built capacity of these hygiene promoters so that at least they can be moving around the communities and in the households. And then we are also collaborating with some community radio stations so that they can do some edutainment programs for behavior change. And we have supported our hygiene promoters with the bicycles. We have bought 32 bicycles and we are in the process of buying another consignment of 64. In terms of the community empowerment and safeguarding the rights of patients, so we noted that there were a lot of issues in the health centers or health facilities due to COVID, because other healthcare workers were afraid of getting infected, maybe due to inadequate PPE, and then also some perceptions on COVID. So we worked in collaboration with the Ministry of Health through the Quality Management Directorate to revive hospital ombudsmen in 5 districts, because these are structures where communities or patients and clients can provide feedback on issues or challenges that they're facing in the when they are accessing healthcare services, and they can also use this as a platform of rating the quality of services that they are receiving. So apart from building capacity of or reviving the hospital ombudsman, we went around as well to raise awareness among the communities so that they should also know the existence of these structures so that they can utilize them. And we have been working closely also with the traditional leaders as chiefs or church leaders, just for them to be champions in encouraging adherence to COVID-19 preventive measures at community level. Apart from that, we have also been providing some technical support as a WASH expert organization. So we have worked and collaborated with some private companies that came forward to support communities and health centers with provision of safe water. So these are companies that are not into WASH. One of the companies is a value addition company for agricultural produce. Another one is a company that is into tourism and works in Liwonde, around Liwonde National Park. But then they also took it upon themselves to support in terms of providing water. So we were providing the technical support to them. And during this period, we have also developed a strategic partnership with GIZ so that we can help in rehabilitating water and sanitation systems in some of the treatment centers in the country, starting with, I think, the main treatment center in Lilongwe and also in Ideta. And then we have also engaged with the minister and directors in the Ministry of Education to provide guidance in preparation for the reopening of schools. We had noted that when it was announced that schools will be opened, the guidelines that were developed, they were lacking on some aspects concerning WASH. So we had to come in and engage the directors and the minister at a roundtable meeting, and then also propose the need to do the WASH assessments in schools, which are currently now happening. And as WaterAid, we are also constructing 20 boreholes in Zomba and Machinga, just to make sure that a greater population has access to safe water and is able to practice good hygiene. So for us, the way we have approached our response to COVID is not only just to end the benefits of our interventions to end once the pandemic pans out, but we want them to last so that the communities can continue enjoying the benefits of such interventions. I think that's all that I had to share, and thank you so much.
Thank you very much, Natasha. That was great. Mary Popple at JTS, Just Trading Scotland, asks whether the information resources that the project created might be shared with rural areas trying to do the same thing in the north. And Mike Beresford asked whether you'd kindly tell us which districts in Malawi WaterAid's working in, please. Okay.
So in terms of the materials, that's something that we can share and maybe we can link up. I will drop my email so that maybe we can connect. In terms of the districts where we are working, so we are in Zomba, Machinga, we are in Lilongwe Urban, and we are also in Nshisi, Kasungu Urban and Kasungu Rural. We are also in Nkhotakota. So those are the districts that we are working in, and Mangochi as well. Sure.
Super, Natasha, thanks very much indeed. And a question and comment put into the chat by Mike Beresford. Mike, sorry, I don't think we'll have time to come to that one, but it's there in the chat for everybody to see. Thank you very much, Natasha. I'd like to turn now to SCIAF and to Ian Dunn. Ian, you're very, very welcome.
Thank you, Stuart. Hopefully I will come up. Yes, so my name is Ian Dunn. I'm the Communications Officer at SCIAF. And It's always good to do things with the Scotland-Malawi partnership and see familiar faces, or at the very least familiar names today. I'm also fortunate that we've got a couple of my colleagues, Blessings Kishele and Claudia Iosa, have joined us on the call. And if you have questions at the end, I will probably refer to them, as I am very much the dancing bear of this operation. But I'm going to talk through a little bit of what SCIAF are doing in Malawi in response to COVID, particularly around the Climate Challenge Programme Malawi, which is a large Scottish Government funded programme we run over there, and just talk briefly about a few of the lessons and conversations that we've been having about things that we might have learned. So, SCIAF, for those who don't know, is the development agency of the Catholic Church in Scotland. You know, we operate all over the world, but Malawi is one of our 8 key countries that we focus on. We have a wide range of projects there, in a whole range of geographical regions and a whole range of different thematic areas. SCIAF, we work through partnership working, and also we are very much, our work is very driven by the communities we work in, but also the local partners related to the church and not. Some of the projects we have active in Malawi are kind of EU funded projects with working with people with albinism in Zomba, and also a vocational programme as well that provides vocational training for young people. In response to COVID, every programme we have has had to be adapted, obviously, to reflect the changed circumstances and the different ways of operating. Our sister agency, CARICOM, Caritas Malawi, we worked with them on a particular response that's covered prevention, communications, healthcare, and preparation and testing throughout the country. And we've also supported specific responses in Mangochi and other regions. Throughout that, the flexibility of our partners and also our funders has been a tremendous help to us in being able to continue to carry out the work we're doing in these difficult circumstances. The Climate Challenge Programme Malawi, which is a 3-year, £3 million Scottish Government programme which we administer, which works with around 50,000 people in southern Malawi to improve their resilience, their adaptation to the impact of climate change by helping them get better access to food, water and energy, and also through improving climate literacy and knowledge of climate justice in Malawi. Again, that programme administered through local partners, every aspect of it's had to change, had to adapt to the way it's carried out. But there's a couple of kind of key things that I'd kind of like to talk about, that I think about in kind of a broad heading of using old ways to do new things. Obviously, improving access to food. We do a lot of agricultural training in small and larger groups in communities. With COVID, that's not been possible to get those groups together. So our partners have worked with the Radio Farm Trust in Malawi to develop a series of radio programs into Chiwa for communities with different tips and tricks about how to use organic, sustainable farming techniques in their communities in ways that help them. And radio obviously is an old thing, but by using it, we've been able to reach the communities we work with and a much greater audience beyond that in these restricted circumstances. Another important aspect of the work is the kind of climate advocacy. We work with a couple of student groups at Lunar University and also Blantyre Catholic University of Malawi and Blantyre. And those student groups were fantastic. They're brilliant advocates for climate justice. They often go out into communities, they go out into the towns, they'll campaign. And again, things that are not possible under COVID. So one of the things they did was reach out to the television, to Zodiac TV, and they made a number of programs with them talking about climate change, talking about the impact of the CCPM. I was going to show a short clip of that, but we're a bit pushed for time and my technological knowledge is not the best, so I'll pass it. But I would say, and we can share the link later, the level of policy debate on that programme on Malawian TV is better than anything you would get in the UK. There's greater depth there, which is something to consider as we approach COP and climate change being such a key theme in the year ahead. And the final thing that I would touch on is another thing that's, well, it's not that old, but video calling and Zoom and Skype and things like that. We used those things before, but we didn't use them half as much as we do now. And the way we use them has changed. And, you know, I think the programme officers across SCIAF have found that they've been able to, the move to online coordination has been really effective for them. It's helped strengthen their relationships with the Malawian government, with other NGOs and partners in Malawi. It's helped us roll out an improved system of safeguarding much faster than we could have done otherwise. I think a lot of meetings in Malawi among our partners that would have happened face-to-face are now happening online, so we in Scotland can join them, and that helps us build our relationship with our partners in Malawi, gives us a much better understanding of what's going on. And I think that there is something there, because something we used to say in SCIAF was, you know, you can maintain a relationship over Skype, but you cannot build one. And there's a bit of truth there, but it's not the whole truth. We have to use old ways and new ways to maintain and build relationships between our two countries. I think that's so much of the work all of us are doing, and is building, maintaining partnerships and relationships. And I think in the past, one of the things we learned is we overlooked things, we made assumptions. And I think as challenging as this time has been, if it makes us relook at all the tools we've got and find new ways to use them, then that's something good that will have come out of it. Thank you.
Ian, thanks very much. And it would be great to be able to share that link on the website and on the Slack group. So we'll certainly follow up with that. Thank you. Thank you very much for sharing that. My apologies to everybody for us running a little bit late. But again, I think we've had a great richness of content and many questions, which are much appreciated from you. We'll probably be another 5 minutes if you're happy to bear with us. And I'd like to hand over to Eve Hartswood, who was the driving force behind the faith event that we had last week. Eve, over to you.
Hello, thanks very much, Stuart. And I'm just putting up, hopefully through the screen share, if you can see it, the agenda for the faith group partnership meeting that we had last week, hosted by the Scotland-Malawi partnership. There was broad participation from across organisations from Malawi and from Scotland. It was an opportunity to hear more about the work of mission, care, and health information being done through the Christian fellowships represented at the meeting. We heard about the Church of Central Africa Presbyterian, CCAP synods, from Mulanje Mission Hospital, from EMMS and Caruso Trust, who have all initiated programs of COVID-19 awareness, reaching right into the heart of rural populations. We heard about the CCAP Church and other faith pastors' response to the further limitation of congregation size in Malawi, and why they had entered into discussion with the government to keep congregation limit up to 100. This being done alongside demonstrating preventative measures to protect against COVID-19, alongside theological questions, and importantly, alongside spiritual welfare. So a recording of the full discussion can be found on YouTube or via the SNP website under past events. The talks represented the great work being done to represent God's compassion and reflect the challenges and the opportunities at this time. And we'd like to encourage everyone to take a look at those presentations. Anyone who wants to take part in these discussions are welcome, inclusive of all faith groups. There's a Slack channel through the SNP, and we'd also like to take up conversations via the WhatsApp group, which might be more accessible in Malawi. So if you do wish to participate, send your WhatsApp contact details to the Faith Partnership email or to the Scotland-Malawi Partnership. We're asking people to suggest topics for discussion, and so far we've had a request to talk about children's issues, prison pastors wanting to join the discussion, timed talk over theological issues, and also how faith groups can support and learn from one another alongside other SNP groups. So this discussion will begin and continue online, and we hope to have another meeting of the Faith Forum towards the end of October, which is welcome to everyone to attend. Thank you.
Super, Eve. Thanks very much indeed. For an update on an appeal now, over to Dr. Jenni Barr from the Dunblane Likhubula link. Jenni.
Thank you, Stuart. I'll keep this very brief. You've now added us to your appeal page. The Dunblane Likhubula partnership is 15 years old. It's a small partnership between two communities, Dunblane in Scotland, Likhubula in Malawi. Our main activity as a charity and as a company is sponsoring bursars through secondary school and then following some of these through tertiary education. But we received a special request from our partners, partly, first of all, for fertiliser for some of the poorest in the community who've been so badly hit by the virus and the impact, and then for assistance with PPE. And this was a new development for us. They came with a very specific budget, 7 villages, 33 churches, working with the chiefs, 86 hand washing stations, 2,000 reusable face masks. So we're working with them at the moment for these to be produced. The face masks, we asked a few questions, and we've been had a plethora of photographs of the tailors in the area who are working round the clock producing face masks. We hear today that there will be more assistance coming into the community, but the community are saying that this is very timely at the moment, and it's helping people as they move forward from a period of lockdown. We've said on the website that further phases would depend on fundraising. I think it would also depend on what becomes available in the community, but as a partnership, we're in a good position to pivot. And the dialogue that we've had has been very rich over the last few months. So thank you for including us. Thank you.
Jenni, thanks for amplifying that. As you say, it's been added to our website, to the appeals page, and a standing offer to all members for us to profile and drive traffic to the website, foregrounding your appeal using various social media platforms headed up by my colleague Gemma. Well, next, just a very brief final poll, if we may, for us to take our normal monitoring, evaluation and learning feedback from you. I hope that, thanks to Craig, that has just popped up on the screen there for you to, one, rate the overall quality of the meeting and whether it supported your links with Malawi, as we always ask. Something in addition to these quantitative metrics that we're interested in is a more qualitative input for you to, and please, if you would email us to let us know what you would like to see and hear less of in these meetings, and what you would like to see and hear more of during them. Craig's just putting up the slide there with an email address. If you're able to send to info@Scotland-Malawi-partnership.org, that would be super. But really, any member of staff of our team that you've got contact with that's in your inbox already that you'd like to use, but info@Scotland-Malawi-partnership.org, just to give us feedback so that we can try to improve and make these meetings more useful and relevant to everybody. So finally, really just our thanks to all of you for the rich contribution, the many questions, and the amount of time that you've devoted to this. Our thanks to the Scottish Government Minister, Ms. Jenni Gilruth, MSP, to Dr. John Phuka, the co-chair of the Malawi Covid-19 Presidential Taskforce, to Dr. Tony Ho, Natasha Mwenda of WaterAid, Ian Dunn of SCIAF, Eve Hartswood, Dr. Jenni Barr there, and to my colleagues Craig, Gemma and David for all of the work behind the scenes. And indeed we have a lot of active members behind the scenes suggesting topics, agenda items, questions and so on. So there's lots of unseen peddling going on under the surface to try to make things as relevant as possible. Finally, just a A reminder that the 10th meeting of this group will be part of our AGM on the 3rd of October, Saturday the 3rd of October. So do please save the date for the afternoon of the 3rd of October. A formal invitation and more details about that will be provided in due course. For now, thank you all very much, and do take care, and we'll be providing the full recording of this available through our website on YouTube with timestamps, and we hope that that's useful. Thanks very much. Take care. Bye-bye.
Can I extend a very big thank you to Stuart, who continues to do a fantastic job chairing these meetings so well. So I'm sure on behalf of everyone on this call, thank you very much indeed, Stuart.
Thank you.
Thank you. Bye.
Thank you, everyone. Bye.
Thank you. Bye.
Thank you. Bye.
Bye-bye.
Thank you. Thank you. Thank you. Bye. Burro.